COVID update, I want to start by remembering Jefferson County Sheriff's Deputy Brandon Shirley. I talked to his family by phone a few days ago and this morning, met them in person at the beginning of his visitation. It's an incredible family, and seeing their strength was something special, especially after such a tragedy. And thank you to Deputy Shirley for his service, and you could see how much his life touched other people. Deputy Shirley's murder, like all murders, was senseless, and the authorities need your help to solve this heinous crime. Those responsible must be brought to justice for taking this young deputy from us. He was just 26. Please come forward if you have information. For his family, for the Jefferson County Sheriff's Office, and for the community, one that you could see absolutely loves this young man, please know that Brittany and I are thinking of you. All right, for today's COVID update, we are at an alarming place. Yesterday, we passed a grim milestone, more than 500,000 cases of COVID-19 in Kentucky. This comes as the more contagious Delta virus is causing a surge in cases across the country, and we are in the midst of the fastest surge that we have ever seen in COVID in the Commonwealth right now. One of the things I've been stressing for many months now is even in the midst of this pandemic, we know how to get our lives back to normal, get our kids back to in-person instruction, and allowing the safe and sustainable continued resurgence of our economy. That's all dependent on us addressing this virus the right way, using science, using facts. So, in fighting this virus, we've been talking about two goals. We have three. Let's put them up. The first, what it's always been, saving lives and protecting the health of our people. Remember, we've lost over 7,300 Kentuckians. That's more than any two, maybe any three wars in our history put together. This is killing our people. And so to everyone out there who isn't willing to do your part, people around you are dying more than you have ever seen in your lifetime. All we're asking you to do is to help keep other people on planet Earth, to do your part for humanity, to love your neighbor as yourself, to be a good person that cares about the people around them. Number two, in-class learning. We want our kids every day to be able to be in school, and we know we have to take steps to make that happen. And number three, it's not to keep our economy open. Our economy is going to stay open. We are in the midst of a special time of resurgence where potential prosperity in front of us is greater than I've ever seen, and we cannot squander that incredible opportunity. Sure, it comes with challenges, but the potential payoff in who and what we can be here in Kentucky has never been brighter. And whether or not we can reach that, whether or not we can shatter any ceiling we had here, whether or not we can ensure we are never a flyover state ever again, is about how we address this virus. And across the country, but especially across the South, the things we are seeing are deeply concerning. I mean, already COVID has contributed to the deaths of 615,000 Americans, and before today's report, 7,387 Kentuckians in 17 months. According to the CDC, this variant is twice as contagious and more deadly than anything that we have ever seen. The surge is driving the fastest rate of growth in new cases, and we're going to show hospitalizations because that is absolutely alarming here in a minute. But let's start by looking at what's happening at places that are just weeks ahead of us. Let's start with the first clip. Hospitals in the South, and remember this is always hit below us and moved up, are filling up. They are running out of space, and they are running out of staff to treat people not just with COVID, but then to help that person that has a heart attack, that has a stroke, that is injured. Those beds are filling up, and in many, many young people, including many children's hospital admissions, we are seeing more than ever before. We don't do this right. We don't do our part. Our hospitals get overrun. It is happening all around us. Let's look at Governor Asa Hutchinson. I know him, and this was him being willing to tell the whole nation how bad it is in Arkansas. In the entire state of Arkansas, there are only 8 ICU beds available. I want you to think about that. There are at least 8 people that need an ICU bed in a state that size every day. Who's not going to be able to get it? You can not believe in COVID, but if you or your loved one needs an ICU bed and they're filled, then your failure to do the right thing could result in a loss of a life that you care so deeply about. And we are seeing the surge that we have seen in those places happening here in Kentucky. Let's look at our stair-stepper chart. This doesn't even include today. Today, we're announcing 2,500 new cases. That's the most since January, I believe, 11th or 10th, and I want to show you where that is. Look, we are right back to one of the most difficult places we've been. Today we have 7 deaths, 7 amazing Kentuckians, children of God, irreplaceable, that are no longer with us. When we look at the increase and the slope of the increase in cases, it continues to get steeper. And look at how quickly it's happened. On the far left, that's June 21st. That's what, 6 weeks ago? And how fast we've gone from a time when we were in a relatively safe place to a time when we should all be highly, highly concerned. You look at our positivity rate and we see the same thing. All right, this one is the one that is the highest since January the 11th. When you compare that, there have only been four weeks in the entire course of our fight against this pandemic that have been higher than the positivity rate is right now. Today, it's at 11.05%. And when we look at the positivity rate and its rise, we see it continue to grow. Even though we are at a point where it is hard for positivity to grow, we are that high, it continues to increase. And let's bring up our state. Folks, 108 counties, red counties, we are all in the red zone. Let's not pretend that just because your county is a slightly different color on here, there's not as much COVID. It is everywhere, and we all need to act like we are in that red zone. Now, the next 3 slides are the ones that ought to concern us the most. And as we go through them, they're about hospitalizations, Kentuckians in the ICU, and that's a big deal. An intensive care unit means you need a whole lot of help. And then Kentuckians on a ventilator. And as we show these, I want you to look at the slope, how quickly these numbers are increasing. We're getting close to a straight line up, which is what we always called exponential growth. That's when we get overrun. Today, 1,251 Kentuckians hospitalized for COVID. So that line for today now increasing even more. Again, that is the most significant severe slope, meaning the rate of growth is the highest it's ever been. We are doubling the number of Kentuckians in the hospital for COVID every 2 weeks. Faster than we've ever seen, fast enough that it can get out of hand very quickly. Let's look at Kentuckians in the ICU. These aren't just people that need to be hospitalized, which in and of itself is a big deal. These are people that are fighting for their lives on a unit where they need a lot of help. 339 Kentuckians in the ICU today. Again, the most severe slope that we have seen. And now let's look at Kentuckians on a ventilator. These are people that before they are intubated are begging for this vaccine, and it's too late. These are folks that we hope we can stabilize, but they're at a point where their families are having to look at hard realities. 168 today. Again, just look back where we were in June. In June, we were in one of the best places that we have been since nearly the beginning of the pandemic. And now, maybe weeks from being at one of the worst places. I want to try to show it graphically in a different way. Honestly, trying to do anything and everything I can to where people will see and understand the truth. There aren't two separate sets of facts. There's only one truth in all of this, that COVID is increasing. It is increasing significantly, and we're going to need people to get vaccinated, and we need people to be wearing masks. That is the truth of where we are. So let's look at hospitalizations and the increase just over the past 2 weeks. This is where we were on July 26th. That's where we are now. Let's do the same with the ICUs. 2 weeks ago, and now, doubling very quickly. Finally, ventilators, and now. Crystal Miller is the local health director of the Wedco District Health Department. She was standing next to me the second day of this pandemic as the first cases in Harrison County were in her region. We have fought this battle every day together. This is the first time that we have seen this. Crystal says we have the highest rate of COVID admission in our local hospitals today that we've seen in this entire pandemic. Let this next one sink in. The COVID unit is full. Our local hospital CEO told me that his day begins and ends with texts from other CEOs around Kentucky asking if there are beds available to transfer patients. This is the most concerning thing I've been told since the pandemic began. This somebody was standing right here on day 2. And this is where we are today. Surge of hospitalizations, certainly nationally, is also hitting kids in a way that we haven't seen before. And as a dad, I can tell you it's something that I worry about, and we should all be worried about. Recent CDC data shows an average of 192 children with COVID being admitted to U.S. hospitals every day over the past week. 192 kids. It's 45.7% increase from the prior week. The American Academy of Pediatrics reports more than 71,000 children and teenagers were infected with COVID-19 last week, up 84%. So to talk a little bit more on this, and I know that we're having some technical issues. I don't think he's going to be able to hear us, but I think we're going to be able to hear him. I'd like to introduce Dr. Scotty Day, Physician-in-Chief at Kentucky Children's Hospital. He's joining us virtually today.
Thank you, Governor, for having me on here today to talk a little bit about COVID-19, both at Kentucky Children's Hospital, across the state of Kentucky, and across the United States. As you mentioned, as a representative from the American Academy of Pediatrics and Children's Hospital Association, this is very different than what we saw the first time around. You mentioned the number of children that have tested positive. And as we look across the country at the case rates, pediatric cases are representing anywhere from 14 to as much as 17% of the total cases, which is very concerning. Now, as we know, a majority don't necessarily end up in the hospital, but what we've noticed with this pandemic is there has been an increase of hospitalizations in children week over week. As we talked about it, average of 190 to 200 children with COVID-19 are admitted to U.S. hospitals every day. And that gives a high hospitalization rate that's very concerning. If we look at our partners who are in Florida and other parts of the state, with one children's hospital in Miami reporting 39 children in the hospital with COVID, 7 in the ICU. That's a drastic change. Because of that, that's sparked a lot of concerns about what had seemed like a silver lining. If you remember early on when we talked about it, the children were mostly spared. But I think we've seen hot spots across the country of child cases that are coinciding with adult spots. There still remains a little lack of clarity whether the spike is related to more kids catching the virus, because as you've discussed, it's more virulent, or is the virus somehow making the kids catch it more ill that are requiring treatment at the hospital. Things are moving quickly, and we know that many children are not being tested across the country, making it kind of difficult for us to understand what's happening. As many may know, the mortality rate in children is estimated about 400 children have died, which may seem like a small number in relative adults, but these are children. These are the future generations. These are, to a mom, to a dad, and if you've been in by the bedside and had those discussions, to them, you can tell them it's 1 or you can tell them it's 400, but to them, it's a Kentuckian. And as one colleague kind of referred to it, kids we think of as being healthier, and, kids are not immortal. And it should be rare that a child would need to go to the hospital. So the fact that we have a few hundred died is too many, way too many. And as we talk about it, the number of COVID-19 deaths among children is more than twice the number of pediatric flu deaths reported by the CDC between 2019 and 2020. And part of the reason is we know we really want to get as many people vaccinated as possible. And that's the main reason I think that COVID-19 that we feel is deadlier for children, because a lot of the other infectious diseases, polio, measles, diphtheria, there's vaccinations for. So in addition to that, to the COVID surge, we're seeing an unseasonable spike in other respiratory illnesses. So our children's hospitals, both here and at Louisville, are seeing bed spaces being taken up by a variety of illnesses that typically we would see only in the wintertime. So it's really crucial for us to protect our children. It's crucial for us to really discuss the ways that we protect our children. I'm the first one to say that in-person learning is so important, but as we know, we need to protect our children so that we don't end up, as we've talked about from the American Academy of Pediatrics, schools canceling. We need to keep our children safe. When we look at it, there's also long-term consequences that we've seen a little bit more here, probably than acute infection with the MIS-C, which you've discussed here before with the multi-system inflammatory syndrome in children. Median age of that's 9 years. Here, we've had 26 cases at UK. Some of these have varied in severity to being on a ventilator to some requiring more intensive therapy, including ECMO. It makes your immune response kind of against your own blood vessels. So it's interesting. This is something we really are taking serious as we look at other places across the country, as they've noticed in other parts of the states, as the adult surges rise, the children's surges rise. So we're very concerned. We appreciate the attention. This is a serious public health matter. Thank you, Governor.
Great. Thank you to Dr. Day. I know that played over the feed. For those that are in the room today, we'll replay it at the end. Without intervention, at the rate that we are currently at, we expect to have the most Kentuckians hospitalized due to COVID in 2 weeks than we have had at any time during this pandemic. To tell you a little bit more about the situation in Kentucky's hospitals, I'd like to invite Miriam Haas to speak. Miriam is a nurse manager at Norton Brownsboro Hospital. She's worked there since 2011 as a med-surg nurse and then becoming nurse manager in 2016. She currently manages a 48-bed unit, which is staffed by 120 employees. And Miriam was one of the first individuals in Kentucky to help treat somebody with COVID. Now, she has been fighting this battle since the first person walked into her hospital. And I got a chance to say earlier, we are so grateful. You have the right to be really tired and really frustrated, but we need you. We care so much about you. And in you, we see, and your colleagues, such amazing strength You help keep us going.
Thank you, Governor Beshear, for having me today. As was stated, my name is Miriam Haas, and I am the nurse manager at Norton Brownsboro Hospital. I am here today to talk to you about what we are seeing now in the hospitals as compared to when COVID-19 started. I'll never forget getting the call on March 8th, 2020, that we had the first positive COVID patient in Jefferson County on my unit. I was at an event for my son and stepped out of the room to take the call. When I walked back in, I remember looking at my family and everyone there and thinking, they have no idea that everything is about to change for us all. Those first days and weeks were so challenging. As frontline, we were nervous about everything because it felt like procedure and treatment changed rapidly as we received new information on how to best treat the patients. The biggest challenge and fear for me and other frontline workers was the fear of the unknown. What could we be bringing home to our families? What could we be exposing ourselves to? Everyone saw what was coming out of New York City, and that feeling of impending doom will never leave my memory. We were also thrust into a different kind of nursing. Patients suddenly left alone to fight through sickness or to succumb to their illness alone. We went from being patient family-centered care to us as nurses quickly filling that role, being a patient's family while their real families were on Zoom. Every time we had a patient pass away from COVID, we would have just their nurse in the room with them, holding their hand. The rest of us would gather outside the room and say a prayer for our patient that was passing, as well as our nurse that was in there with them, that they were able to bring peace and comfort to not only that patient, but to their family member in that moment. We work on a med-surg floor who typically sees patients who are fairly stable. Suddenly, we were caring for patients who became unstable very quickly and who would need to be transferred to the ICU just as quickly, while we were doing everything in our power to help them breathe. To say it's been a whirlwind and taxing is an understatement. Over the past 18 months since COVID started, we have been flooded with sicker patients, and our hospital volumes continue to rise. Our staff is exhausted and feeling burnt out, with many leaving the bedside altogether, which is adding a new challenge to this pandemic. These past few weeks, as we have been seeing more patients with the Delta variant, we have had to deal with a new problem: younger patients who become unstable more unpredictably. These patients tend not to have any other illnesses that contribute to their sickness. They don't really even have anything in common with each other, except that they have the Delta variant, and many of them are not vaccinated. With this new wave, we have the benefit of knowledge gained, but we now have the difficulty of our non-COVID patients being more ill than they were before, as many of them prolonged seeking treatment for their illnesses due to the pandemic and our rising COVID numbers. Many of our COVID patients voice their regret in having hesitation to get vaccinated and say if they had it to do over again, they would have received the vaccine. As a nurse, this has been the most difficult thing I have been through in my 13-year career. The things we have seen will never leave me and have impacted me and my team more than I can express to you today. The stress of leading a team through these trying times keeps me up many nights. Having to call a patient's family member to tell them that their loved one is being transferred to the ICU due to their diminishing condition and difficulty breathing, and staying on the phone with that family member as they sob because they can't be in the hospital with them is heart-shattering. We were called to be nurses, to serve our community, to make a difference, to provide our patients and families with exceptional care, and we will continue to do our best. We ask that you be vigilant, know that people are very sick, and that those who show up to care for you every shift are giving their all. 18 months in, scared of what's to come and exhausted from what they've been through. Thank you.
Thank you, Miriam. And again, on behalf of the Commonwealth, thank you. And I hope you and your colleagues are taking care of yourselves too, as much as we can as we push through this. All right, let's take a quick look at vaccinations, and then we're going to talk about our next step in fighting this virus. As of today, we have now had 2,376,000. This is from before today, 891 individuals vaccinated here in Kentucky. Saturday through today, that's 31,963. So we continue to see more people vaccinated in these last several weeks than the weeks before. It's about 1.8 or nearly 2 times more. We had our first county cross 70% vaccinations, and that is Woodford County, with Franklin County, where we're at right now, next at 68%. But I will say this Delta variant is so aggressive. We see some of the same problems in these 2 counties, even with that rate, which means we have got to keep pushing and we have to keep going. I want to break down, again, we always talk about demographics, which we look at age on vaccination, and then geography. So first, total Kentuckians vaccinated. As you can see there, 18 years and older, we're still at 64% of all Kentuckians 18 years and up have gotten at least 1 shot. I know the national news talks about 2. I'm trying to get at least 1 in people's arms. This is how we've judged from the beginning. It's how we're going to continue to. This lets us know that now this amount of people have at least some ability to fight back. And remember, if you've had COVID and you haven't gotten vaccinated, you're 2 times less defended. You're 2 times less protected than you would be if you go ahead and you get that vaccine as well. That is a study. It's by the CDC. It's from Kentucky. It is factual. No matter who else is trying to tell you anything else. If you've had COVID, you need to get the vaccine too. Again, fact. All right, 65 and up, added a percent, now at 84. Again, we want to get this to 100. We are excited about where this has been. This has taken a whole lot of work from Kentuckians, but this also says maybe those amongst us that have certainly been here the longest, that we could at least, my parents would tell me, are the wisest, are getting the shot at the highest rate. 50 to 64, up a percent to 68. 40 to 49, up a percent to 54. 30 to 39, up a percent to 49. 18 to 29, up a percent to 39%. Again, we like to see these numbers going up. This is not enough. Okay, think about a 1% increase. And now will you show the inpatient line graph again that we did earlier? Right. That slope is a heck of a lot more than 1%. So folks, we need more. We need more people showing up to get vaccinated. Our rate of vaccination is nowhere close to the rate of increase. In other words, we need to make sure that we try to pace or match what the variant is trying to do with what we are trying to do. Remember, the Delta variant and COVID has one objective: to kill as many of us as possible. That's what it is. That's what this virus does. And it will change and it will mutate. It will try to find every single way to get as many of us as possible. Our job is to fight back, which means we got to be a little flexible. We got to be willing to do what it takes too. And if what we have to do changes, we got to change, because the virus certainly will. So let's look at Kentucky counties. First, when we look at geography, we don't have any new counties over 50%. That needs to change, folks. 50% is just half of us. But we do have some that have crossed the 40% threshold. We need them to keep going, but we do want to make sure they're recognized. Callaway, Trigg, Carroll, Estill, and Letcher. I know local health departments, hospitals, healthcare workers, and others, pharmacists are pushing so hard in each of these areas to get people vaccinated. Folks, you need to go get vaccinated. rate of COVID cases and vaccinations, we've been showing this. Vaccines still work. Yes, we're facing something more dangerous, but the level of protection from the vaccine compared to what we face is as much today as when we were first vaccinating people. And your risk, your danger is so much more. Vaccination status, cases, hospitalizations, and deaths. As you can see, 92.1% of all cases, unvaccinated individuals. 91.4% of all hospitalizations, unvaccinated individuals. And 88.7% of all deaths. Now, I know you're probably thinking, I've been vaccinated, and I see these numbers. But you can spread it. That's what we know. None of us, even if we've made all the decisions and are frustrated and tired, and I know we are, doing the right thing, not understanding why some won't get the vaccine. None of us want to harm anyone around us. And if that doesn't get through to you, remember our kids. I've got a child that's not old enough to get vaccinated. So I need your help, and every other parent needs your help too, to make sure we're protecting the most vulnerable around us, who are even more vulnerable right now with this variant when they are not even eligible to get vaccinated. So that brings us to schools. As you know, kids under 12 don't have the opportunity to get vaccinated. And what we are seeing is COVID already impacting our schools across the Commonwealth. We gave a very clear recommendation that every school in Kentucky mandate masking for everybody in the building. Really simple, really clear, and 100% scientifically backed from the very top of the CDC to every local health department. And we didn't see all of our school districts grab a hold of that, but I'll talk in a minute. We have seen a bunch of them, and we've seen a lot of local leadership. But generally, what we have seen is already an impact that shows if we don't do this right, vaccinations plus masks, we will not have the in-person learning we also desperately want and that we need. And let's get a very specific example. And I appreciate this superintendent at least coming forward and being clear about what had happened. This school system has been in class, no masks or masks optional, encouraged, recommended, not required, for 3 days. 95 positive students, 700 staff and students quarantined, 3 days. We cannot keep our kids in school if we are unwilling to put on a mask. I do want to say that there are over 48 school districts that are already requiring it. We're going to hear from Frankfort Independent, first school system, I think, that came out and said very clearly they were going to do it. JCPS, Fayette County Public Schools, Dawson Springs Independent, school system that produced my dad. I know it probably wasn't popular there, stepping up and doing the right thing. Letcher County, recently Bullitt County, and all over Kentucky. Doesn't even have a geography. This is courage, and this is leadership about doing what's right. But we are to the point where we cannot allow our kids to go into these buildings unprotected, unvaccinated, and face this Delta variant. We have already seen through what we have shown you that our kids will not stay in school. They will not get in-person learning. We will have massive quarantines. We'll have parents that can't go to work because 700 kids or staff in one county are going to have to be home and on distance learning. So I'm going to have the courage to do what I know is right, to protect our children. And I've always told people that I'd treat every Kentucky child like they're mine and treat every family like mine. So today I'm signing an executive order that requires that all individuals, all teachers, staff, students, and visitors in K through 12 schools and childcare and pre-K wear a mask. This This is how we make sure we protect our children, but this is also how we make sure that they stay in school. My kids have been going to school for 2 weeks. They've been wearing masks. They're having a big time. And their school system has been effective in what they've done. I'm going to introduce next Houston Barber, and he's going to be the first to talk about today's executive order. And as we run through it, you will see that it is supported by a large coalition of every single public health entity in Kentucky. We'll talk through that. Of the vast majority of our educational associations and of our chamber that's here today to recognize the impact that not being able to be in in-person learning has, not just on our future workforce, but our present workforce. So Houston Barber is superintendent with the Frankfort Independent School District. He currently serves as the president-elect for the Kentucky Association of School Superintendents. Then he's chairman for the Kentucky Capital Development Corporation. Houston, thanks for being with us today.
Thank you, Governor, and thank you for the opportunity to speak this afternoon. It's not about what's right, it's about doing the right thing. I'm so thankful that when we met with our Board of Education before school started, and on behalf of the leadership of our chairperson, Ms. Gina Greathouse, we made the decision to do mask mandate. It has been highly effective. We have seen an extraordinary ability to prevent spread, and we've seen it happen as we've been in school for over 2 weeks, or about 2 weeks. What's remarkable is that we've had a limited number of cases, no evidence of any spread, and I'm appreciative that our families, our parents, and all those who have had the courage to make the right decision to bring the opportunity for our students to wear masks and have masks as part of the experience. But it is so good to be back in school. And I say this because I got to celebrate walking in classrooms, seeing kids learn, have the opportunity to celebrate them being back in school. Some kids who haven't been in school for over 1.5 years. The trauma they face, the impacts that they've seen. It was so welcoming to bring them back to school and share that relationship building opportunity, bring them back into their home where they feel welcomed. Now, having said that, I know there's a lot of questions about masks, but masks work. I have direct evidence of this. When my son was 2.5 years old, he was diagnosed with cancer. He's a cancer survivor. We wore masks during this process. It worked. I understand the frustrations and the challenges that exist with many school systems faced with pressures from families, political leaders, and those who make decisions that pressure those school systems to want to make them kind of force them in a different direction. But this is about our children and about their opportunity to be successful in school and about the courageous leadership that is required by our local leaders and by our superintendents to really move forward to protect our students' futures. So I say one other thing, and that is I want to be in school this entire year, in-person learning. We are working hard to keep that every single day. And this mask mandate, along with promoting vaccination clinics and opportunities, is our opportunity for students to not only thrive, survive, but grow and learn. So I appreciate the opportunity to be up here and look forward to seeing so many successful school districts have an opportunity for kids to come in and just really accelerate this year. Thank you.
As we put out a release later today, you will see the support from the education community. Ranges from KEA, JCTA, and I think we have a quote from them, AFT 120 strong, CASA, which are the school administrators, and many more. Those that are there in the classroom and want to keep the kids in the classroom know what it takes. Again, there is no dispute other than junk and lies that some people put on the internet that masks work. Masks allowed us to successfully get back in school in this last school year. And you've just heard from a superintendent that shows you that in the first almost 2 weeks, masks have worked in his district. And we have seen that where masks aren't required, schools either being pushed back or you got 700 kids in quarantine. We cannot allow that to continue. The education and health of our children is too important. So today's step will make sure that we are protecting everybody's kids and those that work in both K through 12 schools as well as child care. Today's action is also not only supported by the CDC, it's exactly what they said that we need to do. That's the federal. The state, you're going to hear from Dr. Stack. There is no other option. This is absolutely what we have to do, as well as every local health department across Kentucky. That means every public health group, from the federal to the local, is supportive of this requirement that kids and adults all wear masks while inside at school and at daycare. Let's start with our Clark County Community Health Department. This is the quote that Rebecca sent to us. We appreciate her work. Wearing a mask is a simple step to keep our children healthy and safe. The Clark County Health Department recognizes the benefit of in-person learning and support the governor's efforts to keep our children healthy in schools. This is probably not popular for Rebecca to say, but she's right. She's got the courage to do what's right to protect the kids in her community. Here's Kathy Bethel, the Muhlenberg County Health Department. Our children need to be in a classroom, and she's exactly right, 5 days a week for their emotional and mental well-being. That's why she is supportive. Let's look at Debbie Miller from Lawrence County Health Department. We're moving all around the state. Since our children under 12 are not eligible for the vaccine, it makes sense to use another great strategy to prevent infection, wearing a mask. She's pointing out that so many of our kids are defenseless because they haven't been vaccinated. And we would be sending them to the deadliest version of a chickenpox party imaginable by sending them in a classroom every single day without a mask, without being vaccinated, facing the Delta variant. And here's Randy Gooch, Jessamine County Health Department. We've had the opportunity to work with him throughout. He supports the governor's required mask mandate for K through 12 schools until there's a significant reduction in disease to protect our unvaccinated and our most vulnerable students and staff. So we have the support of the education community that knows that this is what we have to do. We have the support of our public health community all the way from the top and down. And today I'm really grateful that we have support from our private sector and our business community. Today we're joined by Ashley Watts and Winston Griffin. I'll introduce Ashley and she can introduce Winston. Again, we're grateful that you're here. Ashley is president and CEO for the Kentucky Chamber, the state's largest business association. Represents 3,800 member businesses from family-owned shops to Fortune 500 companies. We've been working with the Chamber since the very beginning on so many things. I remember us trying to find N95 masks for our healthcare workers like Miriam early on when we didn't know exactly where we could find them. We appreciate their advocacy for business, but we really appreciate their partnership in being here today to support a hard but necessary step. Ashley.
Thank you, Governor. On behalf of the Kentucky Chamber and the job creators of Kentucky, we just want to say thank you for inviting us today. And we do stand in strong support of this mandate that's been put in place. As much, I think, as we all thought that the worst was behind us with the COVID-19 pandemic, we are all looking at incredibly tough decisions to make sure that we can keep all Kentuckians safe and keep our economy moving. Employers, as you all know, are doing everything they can to keep their workforce safe and encourage vaccinations, which is the one way that we know that we can put a stop to this. And like mentioned before, we looked at the numbers in certain counties here in Kentucky, and hundreds of students are now quarantined. That means hundreds of parents are now probably not going to be able to go to work for the next couple of weeks. This cycle cannot continue. I have 2 children that are starting school tomorrow, and they are very excited to be going in person in their mask. And that really is the safest way to do it at this point. We do support masking in schools to keep our children safe, those that cannot be vaccinated yet. We, as adults, need to do everything we can to support our children to ensure that they can start the school year safe and we can keep our economy moving. To tell a little bit more about the business community's position, I'd like to introduce my chairman, Winston Griffin, CEO and chairman of Laurel Grocery in London, Kentucky.
Thank you, Ashley. Thank you, Governor, for having us here today. You know, the Kentucky Chamber knows that we must keep our economy growing, and this means having a strong workforce. We have been through this cycle before. We know that when a student tests positive and the classroom has to quarantine, a parent typically has to stay home, which means not going to work. Not only does it impact the student who has to miss school or turn to in-person learning, it greatly impacts the commerce of this state. Masking will help not only keep our students and teachers safe, but also keep business going. Of course, I cannot stand here in support of masking in schools without mentioning the Chamber's strong support for vaccinations. Because of the innovation of business, we have 3 highly effective and safe vaccines that we know work to prevent the spread of COVID-19 and can get us back to normal, which means going to school without a mask, going to work without mask, feeling safe, and growing the economy. The Chamber recently launched an initiative called COVID Stops Here. We want to recognize employers who have reached milestone vaccination rates and reward employees by having a sweepstakes where they can win prizes for their accomplishment. The business community is truly doing everything they can to keep all Kentuckians safe, and we know that vaccines are the best way to do this. Like the governor and like Ashley, I'm a parent. I have a sophomore in high school, a sophomore in college, and I want them to be safe and have in-person learning. This is the way to accomplish it. We want to thank the governor for having us today, and we hope that soon we don't have to be talking about masking and other safety requirements. But for now, we must do all we can to come out on the other side of this. I implore you, this thing is going the wrong way. Please get a vaccine.
Education community, healthcare community, private sector, all know that this is a step that we absolutely have to take. Again, when you look at the facts, we know that wearing masks in schools will help us stay in person. Not wearing a mask in school will result in kids and parents being home, impact our workforce, impact the education being offered to the kids, and put a lot more people in the hospital. With that, we're going to turn it over to Dr. Stack. He's going to go over his analysis of where we are and where we're going and hit home some points, and then we will take questions.
Thank you, Governor. Good afternoon, everyone. James, do you have my slides there, please? Thanks. Virginia, my apologies. If I talk fast, my dad says I need to not work you so hard sometimes when I get your hands moving real fast. So stair-stepper chart, a 7.4-fold increase in just 4 weeks in September, or since July 12th, 7.4-fold increase in 4 weeks. If you look back to the last time we were roughly around 1,000, that it took 21 weeks to get to 17,000 cases, about 21 weeks to get this far. We did it in 4 weeks this time. This is the fastest and the steepest rise of the entire pandemic. Next slide, James. This is how quick we go from a nice, quiet, pretty looking map to a horribly inflamed, dreadful map. 108 red counties out of 120 today. If colors are your thing, this is pretty visibly, obviously horrible. Next slide, please. 3 slides the governor's already shown. 43% in the increase in the number of people in the hospital in 1 week since August 2nd. 43% increase in the number of hospitalized COVID-19 patients in Kentucky in 1 week. Next slide, James. 32% increase in 1 week in the percent of people or number of hospitalized COVID patients in the intensive care unit in Kentucky. That's a 32% increase in 1 week. And next slide, 61% increase in the number of COVID-19 patients on the ventilator in just 1 week. Folks, that's a near vertical climb. At this rate, in 2 weeks, we will blow past our previous peaks. We are already having, as of today, 15 hospitals that we are aware of reported that are having staffing shortages. Out of about 96 acute care hospitals in the state, that's more than 15% of the hospitals having staffing shortages. Folks, it has never been a joke all along. It's been serious from the beginning. A year and a half in, we wish we had been at a better place. And in fact, we were at a better place. It changes just that quickly because the virus had too many chances to replicate, and pure dumb luck made it smarter. And now it's better as a weapon against humanity. We got to get everybody vaccinated. That is the exit strategy, and I'll come back to that. But if we don't take this seriously and pull together like we have before, it's going to hit us, and it's going to hit us hard. On the hospital data, I need to want to emphasize 2 things. One, if you have a medical or surgical emergency, go seek medical care. Please do not stay home and avoid getting emergency care if you feel you have an emergency. On the flip side, if you have an optional or elective or non-urgent inpatient procedure scheduled in the next few weeks, if you were my family member, I would encourage you to reschedule it. The next month is not a good time to be in a hospital. The staffing ratios are going to get stretched, and it is not a good time to be in a hospital if you do not have to be. You use that as you make your decisions. Next slide, please. We've shown things like this before. It never matters where the specific example is from. It just matters that the pattern plays out over and over and over again. We are all interconnected, whether we choose to believe that or not. This is an example from the North Central District Health Department. That includes Trimble, Henry, Shelby, and Spencer counties. That's up right around Louisville, for those who don't know that, outside Jefferson County. In one of these counties, there was a church where at least 18 people were positive. They exposed people who went on to expose folks at a daycare, another daycare, an assisted living facility, somewhere in a different state, and at a factory. So we had one venue. In this case, it was a church. Doesn't make a difference. Could be a community center, could be a daycare, it could be a business. Doesn't matter what the setting is. It would happen to be a church here. And 32 cases associated with an exposure at that one church. 56% of these people were unvaccinated. My colleague, Public Health Director Rania Rice, put in a quote here from one of my predecessors, who is a long-serving Commissioner for Public Health, Dr. Rice Leach. There is no such thing as your side of the canoe is leaking. Folks, we're in this together. You'd better believe that for real. Next slide. This is from my colleague, Tammy Riley, the Public Health Director in Pike County, just to go to the extreme other side, the eastern side of the state. They are seeing, you don't have to look at the numbers on the chart. You can see on the little blue line how fast it's going up. It's happening everywhere. If you think it's not happening in your community, you are wrong. It's happening everywhere. And it is now, as she says here, impacting younger aged people. And they're seeing increase in hospitalizations out in Pike County in younger folks. And she urges that we should all wear our masks, get vaccinated, and is supportive of the governor's decision today to impose a mask requirement in the younger population. Next slide, please. Very, very noisy. I wouldn't normally show this, but this epidemiologist's dream graph, there's all sorts of data in here. All you need to see from this is in the middle, you can see these are age bands in decade of life. And you can see they were much more separated in the middle. The younger folks weren't getting as infected because they weren't at school. They weren't mixing with each other. And we weren't probably testing quite as much. What has happened here, if you look to the far right, every single age category is rising almost in parallel with each other. If you could separate that out, you would see the older, higher vaccinated populations are the lowest of those groups, but they're all rising almost at the same rate. Folks, this is impacting kids. Only 33% of the 12 through 17-year-olds in the Commonwealth of Kentucky have had one dose of vaccine, and there are more than 660,000 children under 12 in Kentucky who are not eligible for vaccination. We have an obligation to take steps to keep them safe. Next slide, please. I don't care where you look, any credible, serious public health or medical authority says the same thing. The American Academy of Pediatrics, all students older than 2 years and all school staff should wear masks at school. CDC, all people essentially over 2, the same guidance should be wearing masks at school. Next slide, please. I'm just so grateful the governor showed. I dialogued with the health department directors yesterday. Every single one of them, 100% of the 61 local health directors serving all 120 counties in the Commonwealth support this mask requirement. And here we have Muhlenberg County Health Department voicing their support for this requirement to keep our kids in school. And the governor's already shown a specific quote from the director there. National, local, and now the next slide, James, and state, and you've already seen this. Every single one of the credible public health and medical authorities in the country are recommending and urging and now requiring in Kentucky that masks be worn in these settings. Folks, it's tough. You've seen the governor and me and the secretary and others come up here and sometimes be firm and hopefully always be supportive and encouraging, sometimes be emotional. It's hard to figure out sometimes what the right emotion is. It would be very easy right now to get up and give off a litany of angry things about where we haven't pulled together. That all leads to a very terrible place. We have survived and gotten through this far, far better because in the Commonwealth of Kentucky, we've pulled together. And so, folks, I've said all along, and I'll say it again today, folks, I ask you, I encourage you, I urge you, take this seriously. If you can alter your behavior and stay away from others whose vaccination status you don't know, you should. This variant spreads alarmingly fast. It has completely changed the landscape in 4 to 6 weeks. And we are just a couple weeks behind the headlines the governor shared from the states to the south of us. Please take action and keep all of us safe. Thank you.
Now, if y'all could see the room that we're in, we've worked to thin out the numbers of people as we try to model the right type of behavior. So today we asked a number of journalists who were going to be here in person to be virtual. And then our technology is having problems. So we are collecting as many of their questions as we can, which I will read and then respond to. But our apologies to those individuals because we asked you to do something, and we will do everything we can to get it fixed. So we have, I think, 3 of our reporters that are here in-house. We may have one come back in, and then I'll go through all the written questions. So in order that I have them listed here, Tom Latek.
I get emails and phone calls from people, and an interesting one I got this afternoon. It says Kentucky Medicaid is not covering telehealth appointments for Kentucky children at Cincinnati's Children's Hospital. They were told that they have to drive up there now for an in-person appointment after they had used telehealth for the last year. They say that if they have to reschedule, then it would be 10 to 12 months before they could get a new appointment. Has something changed in the Medicaid rules?
That's the question, I guess, about a specific individual that is struggling to get an appointment at a Cincinnati hospital under Medicaid. I'll have to check. With Medicaid, we certainly had a robust telehealth program that I was able to do via executive order through emergency powers. Some of that was codified under law, but whether or not that covers all situations is something we'd have to look at on that individual basis. Certainly, telehealth is the way of the future. It helps more people get help quicker. Certainly, there are some occasions where telehealth is optimal, and there are some where you really need to see the person. So we can check in on that question. Alex.
The executive order that you said you are going to sign, is it applicable for a specific period of time?
Yes.
And does this pave the way for a statewide mask mandate, since all of the things that you just said do not bode well for the state as a whole?
So the K through 12 and childcare and preschool and Head Start, I want to make sure I mention all of those, runs for 30 days, but it can be renewed. So we're going to go for this 30 days. And if we need to renew it, we may do it for 2 weeks. We may do it for 30 days. Obviously, when you look at our rate of increase, what the surge looks like, we got to be fluid and flexible with that. We're going to continue to look at these hospitalization numbers. We're going to continue to look at this surge and making decisions about what's next. Certainly, we won't be afraid, if necessary, to institute a statewide mask mandate for those indoors outside of the home. Again, we know what works. I'm committed to no shutdowns. I'm committed to not having to roll back capacity. If we continue to see the surge, then there are two things we do to do that. Number one, get vaccinated. If you hate all the steps that we have to take, if you hate wearing a mask, get your shot. If you're not getting your shot, you're the reason we might have to put back on a mask. If you won't get your shot, you're the reason that our kids are having to wear masks in school. So again, if you won't get your shot and you're complaining about everything else, you're the cause. Please fix it. Get the shot. All right, Drew.
Dr. Stack had suggested discouraging anyone from going in for elective procedures, but with hospital numbers going up the way that they are, do you anticipate a point where you'll have to suspend any kind of elective procedures in hospitals?
I do not anticipate having to suspend any type of elective procedures in hospitals. Our hospital systems have been amazing partners throughout this, that have done the right thing each and every time, that have more than earned my trust, that have stepped up and done incredible work. I trust them to do the right thing because they have done it each and every moment. Some are already rolling it back. But for a hospital system that has capacity, putting off some of those could be really problematic too. You know, whether it's preventative care, whether it's things that need to be done. If your hospital system is telling you that they have the capacity to do it, then I trust them, and I believe you should too. All right, Isaiah Kim Martinez. Now, we've already seen school districts go back and forth with recommendations versus requirements. For example, Floyd County, New Albany, it's gotten plenty of pushback and bound to get plenty more. How do you suggest local leaders handle this? Well, they don't have to anymore. Everybody going to our schools, daycares, and the rest needs to be wearing a mask so that they can stay in. Now, I strongly suggest local leadership strongly support it. This is where we provide a united front. This is whether you are on the side of protecting our kids because you know what the right thing to do is, you know it. Or whether you're worried about those that don't want to do the right thing and what they think of you. There come a time in our lives in leadership where courage, backbone, and doing the right thing is absolutely required. And you're going to see, whether that's folks here in Frankfort or on the local level, who's got the courage to do what's right, who's willing to lead in times of crisis, who's willing to be a general, and who is an armchair quarterback. So I hope that we see every superintendent say, yeah, this is the right thing. It's time. We're going to put our kids first. And I want to be successful. I want to make sure that I can look at parents and say, yep, we kept our kids in school. It didn't spread. Your child is safe, because I was willing to make a couple of folks that may or may not have kids in my school upset. Karen Czar, even some counties with high vaccination rate are seeing dramatic surges. Listen, we're seeing that in Franklin County too. 68% vaccinated. Yet I still heard a story about a child, not with COVID, that had trouble getting an appointment or seeing somebody today. That's what this Delta variant is. It is that aggressive. Listen, in Woodford County, 70% vaccinated is amazing. That means 30% of everybody in that county is at risk, and the Delta variant moves so fast that this is what we're facing. It means we got to push much harder with vaccinations, and we've got to be very careful that we don't exceed our healthcare capacity. Debbie Yetter, are hospitals prepared if hospitalization peaks in 2 weeks? How do they plan to handle the surge? We are talking with them every day. Dr. Stack is in regular communication. We have one system that is here today, and each one has a plan to increase their capacity. Now, we went through that the last time, but I will tell you it will be staffing that will end up being the problem before the actual beds come. Now, one thing, and again, we've seen amazing things from our systems. One thing we've seen is communication with each other at a level that I've never seen before. Competitors have become true partners, knowing that when you face the healthcare challenge of our times, that it takes everybody, and we see them just like we saw from Crystal Miller's statement today, working with each other to make sure that if they don't have the ability to take care of somebody, they're going to make sure that they are at a place where they can. But when our hospital systems tell me that crisis is going to hit us, we're going to do other steps that are necessary, including consider a statewide mask mandate if that's what it takes to protect our people. And I know how some will respond to that, but I care about the lives and health of our people a heck of a lot more than my own popularity, and I hope I've proven that. No more politics, just let's do the right thing. And you know what? Let's hear the right thing from everybody else this time. Look at how bad this is getting. Let's make sure everybody is on the same sheet of music, because there is only one right thing to do when faced with this situation. And you've seen a lot of people have the courage to step up here today from all different walks of life and say and do the right thing. Are there hospitals in any region that are at capacity now? Yes. We heard about one today. I think we have others that are scaling some things back. But again, we don't think system-wide. We're at that point now. But the way this thing doubles, we got to watch it very carefully. Chad, you've rejoined us?
Just seeing a lot of reaction from this, and also talking about hospitalizations. When looking at these rates in terms of Westco specifically, we saw them talk to them yesterday, and they mentioned these rates. How have the hospitalization rates and your decision for the mask mandate, talk about some of the alarming numbers, especially with children that you saw?
There are a lot of alarming numbers that we are seeing right now, and it's truly the speed at which it's getting worse that is the most concerning. We always talked about the curve, right? You remember Philadelphia versus St. Louis? That Philadelphia curve was a diagonal line almost straight up. And that's the concern when we look at where hospitalizations and others are right now. Certainly, it's not just the number of cases, but people are sicker when they come in. We heard that today from Miriam about how they can destabilize or become unstable much more quickly. And I think we're going to find that this variant is more deadly. Now, it is absolutely deadly to the unvaccinated. That's a big concern when, over 18, 63% of our commonwealth is vaccinated. And then when you include everybody else, we're down in the low 50s. It means more than half of our commonwealth is at risk of a very, very serious virus. And then you look at it's not just death. We have long-term issues that people suffer from COVID that we still don't fully understand. For instance, in our kids, we're gambling on what we will or will not learn about long haul or long-term symptoms there. I know people that are suffering from those long-term symptoms. But then it's also loss of opportunity, especially for them. When we don't do the right thing, and most of a school system is in quarantine, those kids are losing out, and they don't have to. So that's why we've made the step today, but we will consider other steps. We will not surrender to the Delta variant. We will not surrender. All right, Al Cross, how confident are you that school officials, principals, and teachers will enforce the mandate? Well, if they care one lick about their kids, they certainly will. If they claim to be educators and every single public health agency from the CDC to their local health department has said it's the only way to stay in school and otherwise you're going to shut down businesses, they will. If they don't, they're going to hear it from every business in their community. They're going to hear it from every parent that's home trying to figure out the computer and ensure their child are getting the education. Again, now's the time for leadership. And we've seen a lot of it. And in many ways, we have seen more in the last couple weeks and really tough decisions at a tough time than we've seen at any other point during the pandemic. So I do have hope. I have hope that we're seeing people step up and do the right thing. And the more that we see that, especially from folks where the people in their community that might disagree know them. Maybe go to church with them. Maybe you're a part of some club together or see each other or their kids play sports together. You know, that's the type of leadership that's going to help to push us through. From WBKO, is there a religious exemption for kids wearing masks while at school? The executive order will list some of the exemptions. Certainly, there are various exemptions under law that apply to different things that may also apply here. But for any school system, I'd ensure that you have your counsel look at the executive order. But let's certainly make sure that any exemption that someone is claiming is real, and it's not their parents trying to fight some political proxy battle with the safety of their children. Our children are not property. They are not chattel. They are not means for us to fight an argument. They are special blessings and miracles given to each and every one of us, and we ought to treat them that way. All right, and the last question is on a totally different topic. When will Kentucky find out if funding for the Brent Spence Bridge is covered in the bipartisan infrastructure bill? Well, it passed the Senate. And that's a good thing because there are billions of dollars for Kentucky infrastructure in it. And I believe that we will have to apply, but the Brent Spence Bridge will absolutely qualify. And provided that is the case, we can pay for our portion of it in cash. No tolls. We can make it happen for a community that's been waiting for so long. And in doing so, we can free up more money to get I-69 done because people of Western Kentucky deserve that bridge. And we can get that Mountain Parkway 4 lanes all the way to Prestonsburg, just like we committed to doing it. This transportation bill goes through. It's not just that project that we think of. It's not just a huge amount of highway and interstate money, but it's truly these large, significant projects that open up a lot of portions of our state. All right, to everybody out there, here we are again. But you were tough enough. You were strong enough. We're at war. The other side hadn't given up yet, and we can't either. We have the tools to win. Let's make sure we're protecting one another. Do the right thing. Wear a mask when you are inside, outside of your home. Protect one another. Now we'll get through this, and we'll get through it together. Thank you.